Uh, there were some needs that we had when we picked up UPC for helping us with the with our answering. Let's call it answering service, which it's more than an answering service. We had a very inadequate answering service that we were using through the hospital campus that we work on, and the patients were getting service that was, even I wouldn't want to have that sort of reception when somebody answered for the phone for me. So we wanted something that was very much like somebody at our office was answering the phone, and the person would feel welcome, particularly if there was somebody who had never had any contact with the office before. The expectations I had of UPC when I signed up with them was that they could help me cover the times when we couldn't answer the phones ourselves. When we had somebody, there was an answering service that really didn't know anything about our practice, couldn't really help the patients except, oh, let me call the doctor, only if it's an emergency. But if there was a cancellation, there was nowhere to put the patient. So my expectation, from what I understood that UPC could do for us, was that the patient could then be appointed into the appointment book and fill in holes where we wouldn't have had a patient otherwise. And it's worked out like that. We've had about 84 new patients over the past 16 months that we've been members, and we've been able to fill our schedule better with those people. And you can ask our scheduler. She's thrilled to come in on Monday morning and find that we've got some of the holes filled that she was unable to fill before. Well, the first thing that we did when we first got involved with UPC was we were just going on a 2-week vacation. And when we were going on vacation, we were going to have the answering service covering and sending the patients off to another dentist. And some of those patients didn't need to see another dentist. They just needed to be scheduled. So it was able to give us the ability to have the office closed, but still be able to get patients scheduled 2 weeks from now when we may not have had patients in there. The other thing it allowed us to do was be able to know ahead of time during the days of the vacation when we were actually around that we had patients that needed a new appointment or that had been appointment or were canceling, so we had some sort of idea when we came back in 2 weeks what was going on. What I like best about UPC is that we get immediate feedback when something has changed in the schedule, when somebody's called in and we're not there, there's somebody to answer them immediately. There's not talking with somebody who really doesn't know what's going on with their office. It's like having a staff member there who's answering the phone, and often the patients don't know the difference. They think they've called the office and they've gotten somebody from the office, and they're thrilled about that. When we first started up with UPC, we thought, this is kind of expensive. This is more than what our answering service cost us. But what we found is that if you really break it down, it's somewhere between $20 and $25 per day that we're getting service, that if it brings in one new patient in any particular day, that could be a patient that's worth $2,000 over a lifetime, $2,000, $3,000, possibly more. And for that $20, $25 a day, that's really inexpensive. So I really think it's a good value. And, we've got the potential 365 days a week that we can have somebody that's scheduling patients into our book, that new patients call in. They don't want to talk to an answering service. They don't want to talk to an answering machine. They want a person that can do something for them, and UPC can do that for us. If you're a dentist that is thinking about this, they've talked to you about UPC, and you're not sure whether you want to do it, my recommendation is try it. See what it does for you, because they can work with you. You're not under any sort of obligation as far as your month to month. You don't have to stick with it. We've stuck with it for 16 months, and are going to continue sticking with it because we're comfortable with it. It's working for us. It's getting more patients into our schedule, and we've got the peace of mind that our patients are getting service when we're not there.